I'd like to now welcome Professor Paul Glasziou to have a discussion around bibliotherapy and some of the evidence based behind that, and also the Handbook of Non-Drug Interventions. Paul is Professor of Evidence-Based Practice at Bond University and the Director of the Institute for Evidence-Based Healthcare. His key interests include identifying removing the barriers to using high-quality research in everyday clinical practice, including big four problems of antibiotic resistance, overdiagnosis, waste in research, and neglected non-pharmaceutical treatment. Along with the RACGP in 2013, they initiated the Handbook of Non-Drug Interventions, or HANDI, which we'll get to in a little bit. Welcome, Paul. Thanks for being with us today.
Thanks very much, Aaron. It's a delight to be here, and it's great to hear about this initiative of Words for Wellbeing.
Yeah, we're really excited about it here too. I was interested because we had a conversation a few years ago when we were introducing HANDI into the health pathways, and you'd mentioned that one of your sort of lead-ins to HANDI was in the area of bibliotherapy. I wondered if you could give us a bit of the background to that, how you got involved in it and how you see it being used in primary care at the point of care with patients.
Sure. So I've had a long-term interest in non-drug therapies, but bibliotherapy, so the first prescriptions of something that I came across was when I was working at the Inala Community Centre in Brisbane as a general practitioner. Part-time, I was an academic, but working there 3 mornings a week. And a woman called Wendy Brown was doing a study at Inala where we were prescribing exercise to patients, and we had a prescription form. And you could tick on the prescription form and work out exactly what the exercise regime with patients was, or refer them to an exercise physiologist. There was a space on there for that as well, so sort of a referral letter, and then hand that. And it was lovely to be able to hand over something to conclude the consultation. Instead of a drug prescription, you were handing over a piece of paper that had a prescription for exercise. But then I read about some books that you could give for anxiety, for example. So there's been a lot of studies where they did controlled trials of books for mental health conditions. So when I was working in Oxford as a GP, I was in the Department of Primary Care, but also working part-time as a general practitioner. We used to hold a journal club. And one of the journal clubs we held was about bibliotherapy for depression. So interestingly, there had been quite a lot of controlled trials of bibliotherapy for depression, some of which were placebo-controlled trials. That is, they gave people a placebo book. I can't remember what the placebo books were, but one of the active books was a thing called Feeling Good, the New Mood Therapy by a guy called David Burns, who's a psychiatrist in the US. And I'd actually read the book and I thought it was quite good. I learned a bit about cognitive therapy by reading this book for the general public. I read other things as well. And it was the majority of the trials had been done. I think nearly half of the trials were done using his book, but there were a variety of other books that had been tested. And this was effective. So that got us interested. So we decided to look at a whole series of similar books because the UK GPs didn't particularly like the sort of very American version of the book of Feeling Good, the New Mood Therapy. So we got similar looking books. We got all the books that had been trialed, and there was one UK one, and plus some books that looked similar in the content that we thought were close enough that we would be willing to prescribe them as the cognitive therapy book. And one of the important bits of that was that it wasn't just handing the book to the patient. In virtually all of the studies, they also did some sort of minimal follow-up, like checking in with the patient after a week or 2 weeks or something, a few times, and a brief consultation. So not actually doing the cognitive therapy with the patient, but just sort of encouraging them, answering questions about it, which chapter you're up to, that sort of thing. So I think that's important to emphasise probably with any of this sort of information and resources you're talking about, is you probably need that component as well.
And so that's going back almost a decade. Would that be right?
Yeah, about 15 years, in fact.
15
Made
years.
me feel old, Aaron.
Yes, and we're all getting that way. Do you think there's been, because you mentioned that there's good evidence for it, have GPs, do you think, been using books in this way? Has there been a good uptake of the use of bibliotherapy, or is it still remains a bit underutilized?
I think it remains heavily underutilized. All the surveys that I've seen done, though there aren't many, suggest that non-drug therapies in general are underutilized and as is sort of information resources. So I think it's an area that's ripe for better use, and I think the internet will make it easier as well, because I think you should think of it as information resources more generally. Rather than just bibliotherapy. Books are nice, but people may prefer. So with the bibliotherapy for depression, I would often give people the option of, here's a book that you could use, but if you want to do this online program, for example, some people find using that effective as well. So it's nice to have a set of options, and you can have a handout, your prescription, which has those options on it.
Yeah, and certainly the Words for Wellbeing collection that we've put together, it's probably much broader than just bibliotherapy that's been studied. It sort of branches out into more, I suppose, health literacy, includes memoirs of people who've had experience of illness, but coming at it also from a medical perspective. So sort of seeing those two sides of it. Do you think it's possible to extend the research that's been done more on the specific bibliotherapy that we're talking about into those other book domains? Or does that remain more of a, yeah, probably useful, but we can't really say how good the evidence will be around that?
That's a very good question, Aaron. I can see three categories. There are probably more. There's books as the treatment. That is, if you look at the Burns book, it's actually designed to be a patient learning to manage their mental health, their depression particularly, via working through the book. It's a workbook. Okay. Then there are books that don't actually give the intervention itself, but tell you what is effective, that are based on evidence, but the description of that, of what to do, is not in there. For example, Ian Chalmers, who's the guy who founded the Cochrane collaboration, started out with a thing called Effective Care in Pregnancy and Childbirth, for which there was a small book which summarised the evidence for the public about effective care in pregnancy and childbirth, what things should a pregnant mother do, etc., and also about delivery. So I think that's a different type of resource. It's more of a guide to what is effective and what is not in a particular area. And then I think the third, which my wife, by the way, absolutely lived by during our kids, during her pregnancies, she found it an incredibly valuable resource. And I think there are a number of similar books available. And then the third category, as you say, is the sort of more the memoir sort of thing, or somebody's personal experience, which I think helps people understand, but we have less evidence of the value of that particular category. Yeah. But clearly, lots of research to be done too. Keep me in business for a while yet.
And you mentioned before about how, for example, a GP might use a book to, for example, preparing a care plan for a patient, and almost using that book as the catalyst, I suppose, to form a dialogue between the clinician and the patient at subsequent follow-ups. I can see how you could almost incorporate that into, mental health care plans, chronic care plans. Yep. That you're entering into an engagement with the patient and saying, oh, well, when we follow up for this care plan, make sure you bring your questions from that resource that you're working through. So it almost becomes you're working through them together.
Yeah.
See how that's so useful.
Yeah, and there are examples of that, beyond mental health. So just to give you one example that we've got on the Handbook of Non-Drug Interventions, it's the Mediterranean diet.
Mm.
There was a big randomized trial in Spain of the Mediterranean diet called the PREDIMED trial. And it's got the resources, the sort of the recipes, the information things, the food pyramids. But in addition to that, a very important thing that you use repeatedly on each consultation is a 14-item checklist on how Mediterranean your diet is. And so you go through and say, yeah, I'm eating a lot of grains and cereals and using olive oil, but I'm eating too much red meat and da-da-da. So you tick that off, and then you get a score, and then that's something that is used for, it's like monitoring blood pressure. You can monitor the diet with that and then have a discussion. Well, these are the things that might be the easiest to change to up your Mediterraneanness score. And that's how the study was designed. So I think it's useful to think of that use of information resources beyond mental health problems.
Yeah. We mentioned that the handbook and the bibliotherapy and you mentioned Mediterranean diet are part of that. Could you tell me a bit for, it's been going for a decade next year, I understand.
Yep.
Could you tell us more about that as the whole sort of resource? What else is available in that and how GPs access that?
Yeah, sure. So the brief history is that I'd actually tried a few other potential ways of getting Handy off the ground when I was living in England. But it was really at the 2010 college conference that Evan Ackerman, who was chair of the quality committee at the time, picked it up. And then we had to work on it because we wanted a reasonable number of entries when we launched it. And we're still looking for new entries and updating the old entries. And we've recently added some patient resources for the musculoskeletal conditions as well. But the types of things that are in Handy, I think you can think of in 4 broad categories. There's the devices, things like a mandibular splint or a nasal balloon for autoinflation of glue ear. There's exercise, and you need different exercise for different things, for pulmonary rehabilitation or cardiac rehabilitation or knee pain. There's procedures like the Epley maneuver and plantar stretch exercises, etc., wet combing for lice. But a big category is these information resources, and we have books, websites, apps, etc., that people can use. So there's some apps for insomnia, for example. There's an app for smoking to assist with smoking cessation, but there's often books for the same thing as well. And again, I think it's nice. We put all of them in because it's nice to be able to give different patients choices. Some will prefer an internet choice, and some prefer the things that I can see behind you.
Yes. Yeah, I tend to be a bit more on the paper side of things myself. And the Handy resource, it's sort of largely arranged around what we're used to seeing in pharmacopoeia type level of information.
Yes. So that was our aim, was to provide entries that looked very similar to a pharmacopoeia. What are the indications, contraindications, the equivalent of dose, which is the sort of how-to, some practice tips, the practicalities, and often at the end there's a link to patient resources that you might want to use in conjunction with the entry as well, but designed to mimic the entry in a pharmacopoeia or the Australian Medicines Handbook or something equivalent to that. And it's all free. And it's available on the college website. If you just type RACGP Handy into your Google, you'll find it. I can never remember the whole website, so that's what I just type is RACGP Handy, and up it comes. And we're looking. The index is a little
Handy with 9.
yeah. Because it's grown a bit, it's become a bit harder to navigate. So we're looking at redesigning the navigation options and perhaps even allowing GPs to design their own interface that they've got their favourites, for example, would be a nice thing to be able to do.
Yeah, well, that would be. And do you think over the 10 years that it's been released that the GP community have been sort of embracing it, using it with patient care? Do you have any data on how well it's been utilised?
We are going to do a survey of that. My sense from talking to people is that I would say 50% of GPs seem to be aware of it. Fewer than that actually use it regularly. But there are some really innovative things like putting it into clinical pathways that I believe they do in Mackay, that I think help promulgate the use of it. But, you know, in any of these sorts of resources, it's a long-term game. You've got to be in it and you gradually get this takeoff. And so I think by word of mouth and various things, the use of Handy clearly is actually growing.
Yeah, I think we had a chat a few years ago about embedding it into the health pathways, because it was sometimes at the point of care, you could be seeing a patient with vertigo, and then you go, oh, it's been ages since I've done Epley maneuver.
Yep.
And you're needing just a resource to quick reminder of, is this the right patient to be doing it on? Is my technique still correct? Just to maximize the effectiveness, because we know these things are effective. So I suppose that's the summary for Handy, isn't it? It's these high quality evidence interventions, often underutilized, frequently simple, and very cost effective for healthcare.
Exactly. That's why we want to promote it.
Yeah. What's the next steps for Handy? I understand we're going to be linking a survey. Is that a survey you mentioned before?
Yes.
We'll link that into the when we send these recordings out. So what's the next step for Handy that'll be moving on from here?
I think we need to increase the usability of the interface to Handy. So we're looking at developing a sort of separate app or program that you could have on your desktop that you could then individualize it and make it easier to do the prescribing process. A bit like I was mentioning with the green prescription, that you could then sort of tick things off and print that out for an individual patient, depending upon what you'd negotiated with them, so that it's a more active part of the consultation rather than the sort of passive website that you go to and you have to then navigate to print off the materials. And it would then also keep a record of that in your electronic medical record as well. So I think that integration is definitely a future step. And the other one is where we've started already, is more patient materials, things that are actually designed for the patient to be able to do it themselves. There are some like that. So the plantar stretch, for example, is actually designed particularly as a patient handout and instructs them how to do it. But there are quite a few where we don't have the appropriate patient resource yet within Handy, and we need to make that available, but also much easier to prescribe.
Yeah. Just finally, one of the things that obviously we'll be wanting to do with the Words for Wellbeing collection is expanding it, adding to the collection, capturing conditions and illnesses that we might not have covered so far in the collection that we've got already. Part of that is we're hoping to put together or we will be putting together a medical book club. So getting a team of clinicians together who do reviews of books that are put forward for into the collection to decide, are they going to be appropriate to add in, but also using it as similar to a traditional journal club, so that all the issues around the book that are raised we can discuss and add in as a professional development exercise. But I wonder if you were to recommend a book or a particular book that you've had experience of that you think, oh man, I just so wish my patients had read this book, it would just really have helped. Would there be any of those sort of books that you could recommend that we could include in our collection?
So we should have a longer chat about this, Aaron, because it's very, very useful to think of, as I was alluding to earlier, what are the books that are actually the treatment itself? But there's a lot of other evidence-based books that are just giving people an orientation to their condition, but it's an evidence-based orientation. And it would be great to see that sort of literacy being used, but that would mean that the evidence part of it was part of the checklist of the things that you were going to enter in as well. Not just books that have been in controlled trials, but books that informed people based upon good quality evidence. But the other category then, the one that I wish that the patients knew about, was something along the lines of either testing treatments, which is the book that I wrote with a number of colleagues in the UK about what evidence for treatments looks like, and it's designed for the public. I'm happy to send you a couple of copies.
Fantastic.
And the other one is smart health choices, which is similar, but also moves into the area of how do you make a personal choice for you? That is, when you're seeing a doctor, how do you find out what the natural history of your condition is and what your treatment options are to decide what's best for you?
Yeah, that's such an important area with so many choices available in healthcare, and giving patients the right information to be able to make those choices.
Yeah.
Simply because we can do something doesn't mean we necessarily have to be doing it.
Yes.
Well, thanks so much for your time this evening, Paul. It was great to catch up with you again. Was just before we close, was there anything else that you wanted to let the GPs in Mackay know about handy or bibliotherapy that we haven't covered?
No, just to congratulate you on how innovative you are, Aaron, in developing both this Words for Wellbeing resource and also the Handy Within the Pathways as well. Doing great things.
Fantastic. Have a great evening. Thanks very much.
Okay, bye for now.